My last visit was to a doctor who was going to do small needle biopsies. And when he finished, before the slides ever left the office, he turned to me in a dismissive manner and said, well, you have one of two things. You either have thyroid cancer and you have 2 years or so to live, or you have lymphoma and it's curable.
Humanism in medicine is a relationship between two human beings. One of them happens to be a doctor.
Understand that illness within the context of that person's life, their history, and their future.
Caring, compassion, altruism, communication.
Connecting with the patient and the families as human beings.
Putting yourself in that other person's shoes.
Sometimes maybe we forget about the personal aspect about medicine.
You have those skills, but undergirding that is that commitment. You deploy those to help another human being.
Without these ingredients, you're not really a complete doctor.
It can be very challenging to be able to spend that extra minute making that connection with people, and yet it's probably the most important thing we do.
The House of Medicine is built on two pillars. One, humanism, and two, science. Students were becoming enamored with technology, and they were losing the important aspect of relationship-centered care, being involved as a caring, compassionate caregiver.
Arnold not only recognized that as a threat to the traditional, sort of fundamental, foundational values of the profession, but he had the courage to act on it.
What possibly could a small group of people in northern New Jersey ever do to influence the future of medicine?
Establish ceremonies, establish awards, establish culturally meaningful experiences that students are continually reminded about the value that these aspects of medicine have and how important it is to sustain those values.
This first annual White Coat Ceremony promotes the importance of both scientific excellence and compassionate patient care.
I felt like I was on my way to being a doctor.
Welcome to the Medical College of Georgia White Coat Ceremony.
It was so moving, not just as a parent, it was just a wonderful way for these students to start school, to say, remember, this is a really important part of what you're doing.
Welcome to the White Coat Ceremony for the entering class of 2008, the University of Texas Medical School at Houston.
Up to this point, our lives have been sort of all about us, and this is the point where it becomes all about other people. So I thought it was nice to have an official ceremony to say, this is the transition. It's not about you anymore.
Anyone can teach students, diagnosis and treatment and proper treatment, but if I can help them really have that sense of excitement and really feeling that empathy, then I feel like I'm doing my job.
The next day, I called a physician who my husband's had seen in a similar acute phase of illness. And the next day was Friday. And I remember that the phone rang about 5 o'clock in the afternoon, early evening, and it was this doctor that I had just seen. And I remember thinking to myself that he's religiously observant. He should have been on his way home by now, or if not, been home. And I was so deeply moved when he said to me, I'm calling you from the pathology laboratory. He said, and I want you to know that we still do not know what it is, but you don't have the big stuff. So I want you to relax and have a great weekend. What that doctor gave me was an amazing gift. It was like a reprieve, like a stay of execution.
Healthcare profession students, I'm firmly convinced, come into the healthcare professions with a service ideal. And then what is it they hear right off the bat? Oh, you got to prepare for the boards, the technical facility, here's this, fund of knowledge, wait till later. And you hear that over and over, and it really dampens your spirit. And then you go to the Gold Foundation, it's like right off the bat, no, go ahead and talk about caring and compassion and what really is satisfying as a provider.
A lot of our thinking was shaped by what shaped Arnold. We looked at him as kind of a prototype of what we hoped for in our doctors.
Until we saw Dr. Gold, I knew there might be a problem. And we had been through 3 pediatricians. And Dr. Gold examined Max in this very room. And he was so sweet and so gentle. I've never known anyone that could do what Dr. Gold did. Tell me the worst possible thing in a way that supported me in what I had to do. And he was so wonderful to Max and me, and he always told me how great I was. That I never expected from a doctor.
A lot of doctors, I noticed, would hover over their patients, and the patients would sit there like this. I was in the bed a lot with Ari, holding him because he was such a baby, and Dr. Gold would always sit down and look at me. And he would first say, "How are you doing?"
Having somebody who's there, who really listens, who cares, and even if they don't have an answer, or the right answer right away, just that little difference, when things are so bad and so difficult, it's unbelievable what a difference it can make.
In my 20s, I was a homeless youth on the streets and shelters of Chicago, and slowly I worked my way back through college and then medical school. To reach out to somebody's spirit and to give them hope is as much a part of their healing as balancing their electrolytes and performing the surgery and doing the aftercare. So they really have to go together.
There is a connection between the mind and the body, and that connection resides in the heart, and that's where the real healing begins.
One of the most promising ventures is the development of a new honor society for medicine called the Gold Humanism Honor Society, where the first screen is integrity and excellence, compassion, altruism, respect, empathy, and service.
The members of the Honor Society, we hope, are going to become change agents in their institutions so they can actually develop programs, develop projects that can continue to put in real terms, in real time, the kinds of values and attitudes that the Gold Foundation is trying to foster.
For me, the Gold Foundation support has been absolutely essential, and once I had the professorship, it was instant legitimacy in the medical system. I'm not sure that Sandra and Arnold truly appreciate how profoundly they are respected nationwide at medical schools.
The Foundation's done amazing work in reaching out and training more and more doctors. Not only the doctors need to know this, but I think families need to know that they have a right to humanistic care.
Never, never, never would I imagine that the Foundation would develop in the way it did. But I do believe that we have a long way to go.
I think it's going to be more and more important that there be a Gold Foundation that is continually reminding doctors and the public that these are values of the profession that are absolutely essential.
You need a humanism detector. So when a doctor comes through and they're not humanistic, it goes beep, 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 and they don't let them in.
The humanistic touch should not take the place of the technical proficiency, but there's no excuse for the two of them to not coexist.
We wholeheartedly agree. Technical proficiency and the human touch must coexist. With you as partners, the Arnold P. Gold Foundation is working hard to make that happen.